Hi everyone, I'm Anna Zagora, and this presentation will overview the study I did comparing masking behavior in 2020 versus 2022. Before I get into the study, here's some background information on the topic. COVID-19 is an infectious disease that originated in Wuhan, China in December 2019 and was declared a pandemic by the World Health Organization in March 2020. The first cases reported in Fulton County, Georgia were on March 2, 2020. As the disease spread, mask mandates began to be enacted by governments around the world. In Atlanta, the mask mandate began on July 8, 2020, and it was lifted on February 25, 2022. We conducted an observational study. Data was collected on the number of people wearing masks and not wearing masks in the same indoor location in Fulton County, Georgia in 2020 after the mask mandate began, and in 2022 after it was lifted. Our hypothesis was that the average number of people wearing masks will be significantly less in 2022 than it was in 2020. This will aid us in answering the question, did the lifting of the mask mandate have an impact on the amount of people who wear masks? We predict that yes. Without the mask mandate in place, less people on average will wear masks indoors. Observations were taken weekly for 10 weeks in 2020 and 2022 in the Starbucks and Barnes & Noble on the Georgia Institute of Technology's campus. The observations were taken on Tuesdays at around 11:30 a.m. This control reduces confounding factors due to different demographics of people visiting the Starbucks on different days or at different times. Each observation was taken for 10 minutes. This control reduces confounding factors due to under or over counting if different observational time periods were used. And finally, observations were taken for 10 weeks for both years, so there were 10 replicates for each data set. This increases the confidence in our results. More replicates mean that the results are more accurate and more reliable. Figure 1 is a bar graph of our results. On the left, we have the average number of masked people in the Starbucks in 2020 in orange and 2022 in pink. As you can see, the average number of people masked in 2020 was much higher than in 2022. On the right, we have the average number of unmasked people in 2020 and 2022 in the same colors, and here you can see that much more people are unmasked in 2022 than they were in 2020. In both cases, the standard error bars show the significance of the data. For better visualization, here's a graphic I prepared depicting what the inside of the Starbucks looked like in 2020 and in 2022. As you can see from these visuals, the difference in masking behavior between the 2 years seems pretty significant. To determine this significance, we ran a two-sample, one-tailed t-test for difference in means. We ran the test between the mean number of masked people in 2020 and 2022. Our p-value was about 0.0001, which is significant, so we were able to reject our null hypothesis that there is no difference between the average number of people who were masked in the Starbucks in 2020 and 2022. So we were able to conclude that the average number of people wearing a mask in the Starbucks was significantly greater in 2020 than in 2022. A 2021 study by Ajota et al. Found that mask mandates significantly increased mask adherence. Our study agrees with this. We found significantly decreased mask adherence in 2022 when mandates were not in place than in 2020 when they were. However, it should be noted that our study cannot conclude that the decrease in mask adherence was strictly due to the mask mandate ending. There could be other factors involved. Further studies should be done to conclusively prove this. Mask mandates have been found to decrease transmission rates of COVID-19 and to decrease hospitalization rates due to COVID-19. This means the findings of the study have significant implications for public health. These implications can be tied into the UN sustainability goals. First, good health and well-being. Promoting masking in a meaningful and effective way will improve community health and general well-being today by decreasing COVID-19 transmission rates and decreasing hospitalization rates due to COVID-19. Secondly, quality education. Improving education for all, specifically health education, will promote behaviors such as vaccination and masking, which will benefit community health as described in the previous slide. And finally, sustainable cities and communities. Diseases such as COVID-19 are transmitted at the highest rates in cities because of the high population density. Creating cities with more green space and better planning can lead to lower transmission and the lower need for masks if more people are able to exist in outdoor spaces. Here are my works cited, and thank you.